Okay, ladies and gentlemen, it's 3 o'clock for us, at least local time. I suggest that we start right away. My name is Alexey Laureshin. I work at Lund University in Sweden, but currently I have quite big research project related to safety in Africa. So that is my connection to the topic. And today we have one more webinar organized by the AfroSAFE Academy with Matts Åke Belin from the World Health Organization as the speaker. Yes, so just a couple of words what AfroSAFE Academy is about. It's a network of researchers and practitioners working with traffic safety and those who have particular connection or interest in the African context. So as you see, AfroSAFE Academy is affiliated with the ICTCT, which is a large international association of traffic safety practitioners. AfroSAFE Academy is a subcommittee of the ICTCT. And also currently during the setup stage, AfroSAFE Academy is affiliated with a project called AfroSAFE. It's a research project focusing on road safety in Africa. But the ambition is, of course, that AfroSAFE Academy will continue to exist long after the project is ended. I would encourage you to sign up to the news from AfroSAFE Academy. You can get emails or you can follow us on the social media. So the links, you will find them on our webpage. Here are kind of our ambition map. We're still quite early in the setting up all the activities within the AfroSAFE Academy, but the ambition is to promote whatever is necessary to develop high quality research in traffic safety for Africa and in Africa, and also to get it implemented. And implementation is kind of one of the key topics of today. That's what Matts Åke is going to talk about quite a lot. Also, I would encourage you to check quite regularly what is happening, because we have quite an interesting program. We have at least one event per month scheduled until the end of summer. Already we have all the speakers in the pipeline, and we constantly looking for more interesting people to listen to. So please check the announcement are coming up on the webpage and on social media, as I mentioned. Also, I want to advertise the first AfroSAFE conference that will take place in Dar es Salaam in June. The submission for the conference is open right now, so please check the topics, check the conditions, and I hope to see you physically there at the conference. Quite many people from my team and from the AfroSAFE project are planning to go there. Yeah, and here is the website of the AfroSAFE Academy, and also you can always contact us through the email, sorry. And now the speaker of today, Matts Åke Belin, World Health Organization, currently placed in Geneva, but originally coming from Sweden. Matts Åke has a PhD in public health from Karolinska Institute in Stockholm in Sweden. He has been working within traffic safety domain for more than 30 years, being quite a key person in shaping Vision Zero policy at Swedish National Road Administration. He has been affiliated professor.
Jag får inte ljud.
Sorry? Okay. Am I audible? Can other people hear me?
Yes, we hear you. It was Tanya that said something.
Okay, yeah, I continue. Yeah, so Matts Åke has been affiliated also with the KTH, the Royal Academy of Technology, if I remember it correctly, also in Stockholm. So he has experience both as a researcher, as a teacher, and as a practitioner. And now I think, Matts Åke, I will give the floor to you.
Thank you very much. Thanks for having me. I've been in WHO now for 2 years, and I'm working with the implementation of the second decade of action and the global plan. But today I will talking about mainly about how we try to transfer research and knowledge to practice, actually. So that is what I would talking about, basically. And I will give you an example of a model from Sweden. But before I get into that model, I need to put what I would like to talk about in a broader context. So I will start to share my screen here. All right. So first of all, you know, if we try to catch quite complex reality and what we would like to achieve in a country context, the thing that we try to achieve is, of course, we would like to see a reduction of the number of fatalities and serious injury in the country. But to do that, we need to change the function of the road transport system. And the road transport system is a lot of different things. You know, it's infrastructure, it's vehicle and road user behavior and all these aspects. And those are the things that we need to have an impact on if we would like to reduce the number of fatalities in series, and of course, in the long run, creating a safe system. And there are lots of different stakeholders now involved in shaping our road transport system, both governments and municipalities, public actors, but also non-state actors, private sector and NGOs and others. So there are very multi-sectorial road safety, and there are lots of different stakeholders that needs to be involved. And at least that's my experience. Things will not happen by itself. So we also need someone who push this. We need functions in our society to make things happen. And that is what we call lead agency or a lead agency functions, because in these lead agencies, they're working with data and research. They're working with planning and policies. They're working to try to coordinate all these different stakeholders, and they work with promote safety generally in the culture. And today, we're talking mainly about how, what kind of models that we have for transfer data and knowledge to planning and action in general. And if we look at the public health researcher and road safety researchers, there is a tendency to see policy making as a very kind of rational process where we define the problem, we identify the causes, we develop our interventions, we implement these interventions. And you will find that quite clear in reports and others from research from public health domain and from road safety domain. And there is almost an idea that and in political science they call this the stage model. But now more and more research understand and have seen that we need to closing the gap now between what I would say the expert and the research and the practice, because that is different worlds, I would say. And I would like to mention that Sweden have taken some initiatives now through a research program to develop more research around how do we actually make things happen in our society. And before I started in WHO, I was responsible for a research program within this Vision Zero Academy that really focused on these kind of gaps between research and the implementation. Okay, so that is one important knowledge, information for you to understand when I'm talking about this method in Sweden, which calls the OLA. Let me take it also from a more broadly global perspective. In 2004, for the first time in history, the World Health Organization, together with the World Bank, they launched this World Report on Road Traffic Injury Prevention. And after that, lots of things have happened, ministerial conference and so on. But this was a kind of starting point of putting road traffic injuries on the global agenda. And two of the recommendations in this report is, first of all, that countries should identify a lead agency in the government that can provide and work with these lead agency functions. So this is a recognition of that you need a leadership in the countries to make things happen. And the third recommendation was that you also should prepare a national road safety strategy and a plan of action. And based on this recommendation, the World Bank have worked a lot to help different countries around the world to increase their capacity to work as a lead agency. And they developed this kind of capacity review manual, and they have been looking into lots of different lead agencies around the world. And what we can see now when we look at, the WHO, they quite regularly, they launched this global status report on road safety, and they have done it for 5 times now. And just before Christmas, they launched this the latest report, 2023. And when you look at the data in this report, you will find that if you take these things like lead agency, lots of countries now have responded to that recommendation from the UN agencies, and the number of lead agencies that the country reported has increased from around 40% to almost 90%. So most countries right now, they have some kind of lead agency in their countries. And also when it comes to national plans and strategy, that has also evolved during these years. But when I look at some of these plans, I don't want to mention the name of the country, but when I see some of these plans, and some of them, for example, from the Africa region, some of them are excellent. I would say they are very much in line what you will find in top performance countries around the world, in Europe and so on. They are covering the most important things from a safety point of view. They are referred to things like Vision Zero and safe system and so on. But to be honest, when you see this report, you started to ask yourself, how did the planning process look like that end up in this plan? And we know from political science research that the planning process in itself is quite important actually for the opportunities to get an effective coordination. Because if you want stakeholders like let's say, road authorities or the police or municipalities, if you want them to implement certain action and interventions, then probably they need to somehow be involved in these planning processes. But I don't think in many cases they are involved in this planning process. The national strategies, this plan, is sometimes developed by consultants, mostly from the high-income countries that develop this plan. So the plan itself is no problem with them. They are really good, but we miss an opportunity to understand that the process to creating that plan and the follow implementation is connected to each other. So it's very important to see these relations. Okay, so Sweden now, as an example, Sweden adopted, the Swedish Parliament adopted this Vision Zero in 1997. And one of the major aspects in that policy, it's differ a lot from what I would call a traditional approach to road safety. But one of the major, most important aspect is the way that Vision Zero respond to responsibility. And according to the Swedish Vision Zero, I said Swedish Vision Zero because I'm not sure that all Vision Zero around the world had actually adopted this way to think about the chain of responsibility. But according to the Swedish Vision Zero, then, it is the system designers who have the ultimately responsibility for the design, operation, and the use of the road transport system. And of course, the road user, they are still responsible for following traffic rules and showing judgment and be responsible for the way that they behave. But if the road user cannot, or unwilling, or whatever, what the reason is, they can't take the responsibility, then the responsibility, it's returned to the system designers. So it creating a kind of circle where the ultimate, the responsibility starts and ends with the system designers. And this is very important element in this Vision Zero, Swedish Vision Zero. And based on that kind of responsibility, Sweden decided, and that was actually before the parliamentary decision, to start to make in-depth studies of all fatal crashes that happen in the road transport system. And the reason why Sweden wanted to do this kind of in-depth studies was not mainly or primarily because they wanted to understand the causes of the crashes or the accidents. The reason why they're doing these in-depth studies is because they want to prevent them from happening in the future. So the focus on the analysis is actually what could those system designers do to prevent this catastrophe to happen in the future. And so that was the kind of starting point. And from the government perspective, or the Swedish Road Administration perspective, then they realized that, well, it's not only the Swedish Road Administration, there are lots of different system designers that needs to be involved to solve this problem. So they started to gathering some of the data into different problems. And And in this slide, you will see that on the horizontal axis, I put stakeholders, and on the vertical, I put not too complex problem versus complex problem. So, for example, they did, and that is what I was talking more about now, is this what they call the OLA method, the OLA process. They decided to do a OLA around motorcycle and moped riders. That is a quite complex problem. There are lots of different risk factors, and there are many stakeholders that needs to be involved to solve a problem and reduce the number of fatalities and serious injuries among motorcyclists and moped riders. So that was a quite complex problem compared to railway crossings, which is, at least compared to the motorcycles problem, it's not too complex problem, and it's fewer stakeholders involved that can solve the safety problems on railway crossings. So they did a kind of OLA project around that. They also did a project on alcohol, which is also rather straightforward because it's one risk factor, but in the same time there are many different stakeholders that actually can, through their actions, can have an impact on the number of alcohol-related crashes or alcohol-related crashes that turns to fatalities. There are lots of many stakeholders. And they also did OLA on buses and safety. And they did this both on the national level, but sometimes also on the regional level. And on the regional level, it could be very close to well, for example, an intersection or whatever. They could be very practical, actually, these kind of OLA. But the point with this OLA then is to creating a process where you start with these in-depth studies. That was the starting point, but also add other kind of data and research that we have around a problem. Let's say alcohol, for example. And with that data, creating some kind of objective facts and present these facts and discuss this among a bunch of different stakeholders. And the objective with that, because that's a kind of first step in this process, and that was actually one meeting where where the Swedish Road Administration gathering all the stakeholders and run these objective facts and discuss that. And the objectives with that was to creating a common ground for what the problem is. So we have the same view, the same idea among the stakeholders. What do we have here? What do we need to do about it? And then based on these facts, the different stakeholders, they went home to their different organization to discuss that internally and to develop a list or ideas of different solutions and proposals for solutions. And then they organized a second meeting where you could discuss these solutions together in this group as solving the problem or parts of the problem with this solution. And that phase was important because it made it possible also for different stakeholders to hear how other stakeholders thought about this problem. And maybe sometimes one stakeholder is dependent on another stakeholders to actually be able to implement that solution. So you're already in this phase, you could start to have a coordinated action among different stakeholders. But of course, that was a huge list of everything that you could thought about. So it was really a wishing list, I would say. And based on that wishing list, they went back home to their organization, and then they talked more with decision makers within in the organization. For example, in the Swedish Road Administration, some of the solutions that was proposed was also discussed among the manager within that organization. And the same happened with other stakeholders. And the group of stakeholders was not only government officials, it was also private sector, for example. And I remember one of these OLA projects around young drivers, and the Volvo, for example, they came with a solution where you could program your car key to lower the speed. And when, in most cases, when the father, for example, mother, they want to let the son in the family to use the car, they can program that this car will not be able to go faster than 100 kilometers, for example. So these kind of solutions, as an example of the creativity that phase actually could create, and a discussion about many different things. But when they went back with that and discussed it more with managers, then they came back with more concrete action plans, that this was actually something that was implementable, that we wanted to actually do. And based on that, they made it publicly. This is what we are going to do. And based on that, they could go home, and all these different stakeholders did their implementation. And then after 1 or 2 years, it was also a follow-up meeting to discuss this implementation. So this was a quite, I think, innovative method to ensure that research and data also fit into this the practical need. But you know that Alexei's institution, they did actually evaluation of this method, and that was this expert who did the evaluation, and they were quite critical actually, because they didn't thought that within this process the proposed actions was not the optimum actions. So therefore I will stop here, and I will put this because for me it became quite obvious that there is a tendency between optimal versus implementable. And the road safety community have to be cautious and be aware, because otherwise, if we only come with interventions that we know is in a kind of laboratory settings or whatever, that we think that this is well, you usually talk about efficacy, that at least in this context, this intervention is very effective. That is versus efficiency, which you put things into a into a context. And I think this OLA model was actually one way to closing the gap among expert and research and data and what was actually possible to implement. So that's why I think it's a good example on a method that can be used to closing the gap between research and practice. So if I just a little bit quickly go back to my first slide here, I think we really need to discuss now, not only like this global status report that do you have a plan or not, or do you have a lead agency or not? We need to discuss much more how they function and how they work, the processes within them, and if we can make them more efficient to ensure that we in the end have an impact on the number of fatalities and serious injuries. So I think I stop here, Alexei, and
Okay, thank you very much, Matts Åke. So I would suggest to get some order in discussion, please use the chat option. So if you have a question, if you have a comment, just write your name there and I will call you in the order of the names popping up. But in the meanwhile, I will comment a little bit like, it was indeed my institution, but it wasn't me. It was the previous generation. So I'm not as critical as they were. And I really think the point that you raised now, Matts Åke, it really resonates with the topic of one of the previous webinars we had with Henk Stibdonk, who was also talking about that as a researcher, you might have an ideal vision, what is the best, but if there is no interest in society, if there is no interest among politicians, among policymakers, or there are no researchers, or it goes against some kind of activities that it took a long time to get them going and they don't want to lose the momentum, then sometimes maybe you don't really have to insist on going the ideal perfect way. It's better to get done something rather than having nothing, rather than spend time in debates, in those fights, but at the end you don't change anything. Okay, good. So do we have any questions from the audience?
Yeah, Jan Fredrik here.
Please go on.
Yeah, thank you very much, Matts Åke. And I think what you mentioned with the Trafikverket OLA analysis, I've been part of a few of those meetings, and I think it really makes sense that you, as you mentioned, you collect the stakeholders and you agree on actions. So it's a good way to go forward instead of just investigating accident. There is also an action in the OLA system. So I totally agree on that.
Mm-hmm. Yeah. Can you give some examples who were the actors involved, like taking that case of motorcycles? So it was road administration, but who else were involved?
So in the case of motorcycles, it was a huge group, of course. So you have, well, basically in general, you would say that you will have public actors. You will have people like organizations like the Swedish Road Administration. Maybe in some cases you have municipalities involved, at least some of the big municipalities in Sweden, for example, when we're talking about these national OLA. But also you have the motorcycle industry and those who sells these motorcycles. It can be those who working with helmets, but also education and NGOs and others that basically have an interest in this field, you know. And I guess that and is of course evolving these kind of things also. So when it comes to motorcycles and moped driving, that is actually an OLA that continues to develop very regularly, and even in Trafikverket, because the most of the things that I talked about now was in the Swedish Road Administration, but now some of these activities still going on in the Swedish Transport Administration. And when it comes to motorcycle, that is still going on. And I guess, you know, over the time, the number of the type of stakeholders will be evolve, you know. For example, at least when we're talking from a global perspective now, we see that lots of delivery of food and package and all these kind of things is actually done by companies who doing it on mopeds or motorcycles or e-bikes or whatever. And of course, these kind of companies, they should also be involved in this kind of OLA processes. So if you set these kind of things up, you know. But also, I think that what we also saw in especially in the second phase, when we started to talking about different things that we could do, you open up a creativity among the stakeholders, because it is not like the situation where the expert have all the knowledge about this problem, and we have to somehow transfer that knowledge to those who implement. They have a lots of their own knowledge about these problems. So, and that creating a lot of creativity in that phase, so to say. So for me, because that's what I try to say in this presentation, probably you can do it in a different way, but I think that these kind of methods where we have a little bit more participatory kind of approach to working with safety might be a good example, and it might be good to set up in another context than, for example, Sweden. But I haven't seen so much of that, you know, in other places. So that's why I want to push for it a little bit. Let's try it, see if this could be something that we can work with systematically, you know. And of course, in the end, maybe you don't get what you want from that process, because that's for sure that this process can be also complicated, and some of the stakeholders might block some important interventions and that sort of thing. So it's not just like this is perfect all the time, you know. So, but we could develop this, and we can develop also the effectiveness of this way to work.
Mm-hmm. Yeah, I also find quite important that element of public commitment, because
yes.
what I've seen quite many times, people do have lots of ideas, lots of opinions, and they're quite eager to express them. But then when it comes, so who is going to do that? And it's really kind of baked in this process that at the end, you have to come up with a list of what actually you commit to do. You might not be able to do everything, what is the perfect case, but at least to show the minimal level of what you're going to do. And it's not really nice. You do get that kind of peer pressure when everybody suggests, I will do that, and I will do that, and you say, I will do nothing. You also get that type of pressure. Yes, I see Tanya raising hand. Please go on.
Do you hear me?
Hi, Tanya.
Oh, you just switched off your microphone. You are muted.
Now you can hear me. Yes, hi. I wanted to ask Matts Åke about other country where there is this participatory process, but you almost answered, and I had some reflection. I've been active in Sweden the last 25 years, and when I came to Sweden first, I realized that this participatory process is quite broadened in different sectors, and there is a long tradition. And I've been thinking about what are the ingredients? Why is this participatory process? It's a political tradition also, and I think it's based in my view on respect to each other and also trust in others and what they could do. And both those ingredients make it possible to have this participatory process at that level. And do you have any reflection on what well, you said there is no other country that knew that have this, but about those ingredients that you need to have a lucky participatory process, like trust, like respect, or what do you think about others factors?
I agree totally, Tanya, and so there is a kind of context around this, you know, that you have culture, way to work with things in a country like Sweden, for example. And I think you perfectly agree that Sweden in international context usually seen as a very corporate kind of society. So I agree. So that is these kind of factors that might be a barrier for this kind of way to work in different settings and so on. So I don't have the answer actually. I only know that and I would like to see some example on this way to work with these things in different contexts to see if it works or not, or if it's just something that is for Sweden, for example. So yeah, but I agree totally. So you have these kind of context factors that probably is very important.
Great, thank you.
Okay, Laxman.
Yeah, hi. Thanks, Matts, for the talk. So I was just curious to know, like you mentioned the chain of responsibility, and there is the responsibility of system designer and then also the road users. But when I was looking the African context, like where there is also a lot of lack of knowledge amongst the system designer, for example, for safe system and vision zero. So in that scenario, like I was just trying to think, like, where do the politicians fit in that chain of responsibility? I just want to know your thoughts.
The politicians.
Yeah.
Yeah. They will be part of the first. So this is no. I think you touch upon a very important thing, Laxman, and because the traditional road safety work, and also if you look at the regulation that have been built up around road safety worldwide, internationally, that legislation, that formal responsible, put the ultimately responsibility on the individual road users. So if something goes wrong out there, you can always, I would say, always find an individual road user to blame. And that is still the formal legislation in a country like Sweden. But the policy Vision Zero make a huge change of the way to think around responsibility. And within that group of system designers, there you also have basically the concept of system designer is quite blurry, but I would say that all those who have an impact on road transport system, which is not individuals, they are almost defined as a system designer. So the politicians is also part of it, but it's need a first phase actually if you want to work with these kind of things in a society, and in that society they have a very much a blame victim kind of culture, then it's difficult to work with it. It requires some kind of matureness among the system designer to realize that, oh, we can actually make a difference here. We have a responsibility to make it safer. If they have that kind of attitude, then it's easy to go the next step with these kind of processes. So it might be part of those factors that Tanya also touch upon, I would say. So, and I think that if you start to implement these kind of methods in another context, that could be a very important implementation to start to talking about responsibility and so on. Let me take one example. Drink and driving. No. Yeah. Sweden have been working with drink and driving for a very long time. It was actually Swedish doctors who came up with a method how to measure the alcohol concentration in the blood. And that was in 1930s. And based on that, Sweden set up a special threshold for how much alcohol you are allowed to have in your blood when you drive a car. It was 0.08 in that time, 1940. Then they have lowered it from 0.08 to 0.05, 0.02. It's a very severe crime. If you drink and drive, you can end up in jail. We allow the police to stop you anywhere, anytime to check if you are sober or whatever. So there is a huge systems now to prevent people from drinking and driving. And that system have the output from that system is that if we make roundup breath controls of the traffic in Sweden, you will find that 99.8% of the traffic is sober. 99.8%. That's fantastic. So Sweden, they don't have a social norm problem with drink and driving. But when we make these in-depth studies, you will see that 25% of all fatal crashes is due to alcohol-related crashes. That means that we don't have a social norm problem, but we still have a safety problem. So that's why I sometimes said that probably one of the most effective countermeasures that Sweden have implemented the last 20 years to prevent alcohol-related crashes is this middle barrier program. You know, these roads with 2+1 roads with this middle barrier. Because this middle barrier don't care if you are influenced by alcohol, if you're drugs, or you're distracted, or you're speeding. It will only prevent you to killing someone or yourself. And the road authorities, let's say, go back 20 years, they didn't see that as a part of the problem. They were happy to put that problem on someone else. But now we see that actually they are part of solving this problem through these 2+1 roads. And the number of, if you look at some of the analysis that they have done in Sweden in the report, you will see that the number of alcohol-related crashes have going down. The proportion sometimes go up, sometimes go down. It depends very much on the police, I would say. but the number has gone down. And I think that some of the system changes that have been made can take credit also for that problem. And that is that kind of things that needs to be discussed in these kind of methods like OLA, that get a broader view of the problem. You don't sit only in a silo. The police only look at the problem from a police perspective or someone else. You start to work much more broadly with it. Even the private sector can see that they can do something with the alcohol or whatever. So yeah.
Yeah. Thank you.
Sophia?
Hi, everyone. Nice to see you. Thank you very much for this great webinar. Hi, Matts Åke.
Hi.
I just wanted to add one small example for Lexman questions. I'm originally from Bolivia, and I've done some road safety work in my country. And I remember a meeting with the Ministry of Interior, and also the police was there. And they are very, like, the thinking is the traditional way of road safety, right? And they were talking about that the citizens are to be blamed because they don't have road safety education. And we were trying to explain them the systemic approach, right? That is the whole system that you have to consider. And I remember that I used the example, like I asked them, do you know how many taxis I had to stop from the hotel to get to the meeting? And then they said no. And I said 10 cars that they didn't have a seatbelt, a working seatbelt. You know, so I know I have road safety education. I know that to be safe, I have to put the seatbelt. But if the cars that are here in the city, you know, doesn't have the technical reviews, and they can drive without having that, and I don't have a seatbelt, then my road safety education is not bringing me too much, right? So that is why this systemic approach, this overview, this OLA process is so important to consider all the inputs and aspects from different stakeholders and contributors. So.
Yeah, thank you, Sophia. No. That's also a great example, actually, that you see that you need this broader analysis to understand that no one can make it perfect, but together then it's possible to do great improvements.
Absolutely, because another aspect is like talking about the children, you know, then how can I teach a child that he has to cross over the zebra crossing if there's no zebra crossing in the street, or if the cars are not going to stop, right? So this aspect is not bringing too much for the children, right? So thank you.
Thank you.
Okay. Do we have any more questions or comments? Yes, Jan Fredrik.
Yeah, Jan Fredrik here again. And as this seminar is within the AfroSAFE project, the AfroSAFE Academy, my question to you, Matts, I guess you have been many times in different African countries, and we spent a few days in New Delhi, which is also not very different about the traffic situation. But my question is actually, what do you think from when we have this experience, and we know from our experience roughly what should be done, but do you see any extremely good low-hanging fruits that we should focus on to save lives? Is it in your opinion, from WHO organization, is it to go for the vulnerable road users, or to educate the drivers, or is it to produce safer vehicles? Just if you select one low-hanging fruit.
No, I think that in the first decade of action, that has been very much in the focus. The focus has been very much on these 5 risk factors, main risk factors like speed, alcohol, seat belts, helmets, maybe something else. I don't remember now. So we have that kind of knowledge, you know, and now when we publish the next the latest report, you know, we see that we need to broaden that, you know. We can't just talking about this in the behavior risk factor. You need to put this in a much broader context when it comes to vehicle safety, when it comes to infrastructure and that sort of thing. So we need to to ensure that the implementation of a global plan now in the next decade of action take a much more holistic approach to it. And to make that, that's why I think that this seminar and the these kind of methods for making things happen, that is also things that I think that we should try and implement. And it's not very, it doesn't have to be very large, big problem, you know. You could take something very concrete, you know. I know that, for example, if in a country or a state in India or whatever, say that we have a huge problem with, let's say, speed or whatever, then set up a method for them to actually practical, operational, be able to work with it. And you have to have someone who facilitate this, who is the facilitator to get those different stakeholders through these different phases. And I would say that that would be perfect example to try to implement it more concrete. Not only talking about seatbelts or you need a policy. Well, when it comes to seatbelts and helmets, 160, 170 countries around the world, they already have this. It's not that they don't have the policies or the regulation. It's the implementation of this that needs to be much more focused on. So I think this is a great, probably there are other types of methods also, but this could be a great thing to try somewhere in this AfroSAFE project, for example.
Yeah, thank you very much. That's okay.
And if you do that, and it's a success, please let me know, because then I can talk much broadly around it. You know, that's why I would like to see collaboration between WHO and others now to help countries to develop also implementation methods for making things happen.
We have though we have seen that working both in Asia and now in Africa, that it's easy to sit here on our high horses to teach, but then when it comes to reality, it's about transport at all. Maybe they choose between walking or cycling or having a very, very bad car. So in the low and middle income countries, it's a huge problem to change from something bad to something better, because they are already, in many times, they don't even have a bad vehicle. So that is one of the huge problems, the transport need or problem or economy. Okay, thank you very much, Matts.
Okay, great. Laxman, I see your hand, but we really have to round up now. I have an official excuse. I have to run to a train.
Yeah, no issue. Thank you.
But Matts Åke, thank you very much. It's always interesting to listen to you. And I think there is really a very important lesson for many of the countries struggling with traffic safety problems in what you've been telling about. And I really think it might be a good idea for the AfroSAFE, the project itself and AfroSAFE Academy to spread that idea of systematic work, to involve many actors, to put them in a room, close the door, and okay, you are not leaving until we have agreed about who is doing what.
Right. Thank you, Alexei.
Great. Thank you very much, everybody, for participation. The recording will be provided, maybe not today because I will be on the train, but within 24 hours. And I hope to see all of you at our next webinar, which will take place in the middle of February. I don't remember the exact date, but please have a look at our webpage.
Thank you. Bye.
Bye.
Thank you. Bye.
Bye-bye. Thank you.